Last year, we began an initiative called Visioning PM&R Bold. From your feedback and that of thousands of your colleagues, you created a bold new vision for the future of our specialty. Let me read that for you. Physiatrists are the essential medical experts in value-based evaluation, diagnosis, and management of neuromusculoskeletal and disabling conditions. Physiatrists are indispensable leaders in directing rehabilitation and recovery and in preventing injury and disease. Physiatrists are vital in optimizing outcomes and function early and throughout the continuum of patient care. This is what we do, and this is what we need to become. The purpose of visioning PM&R Bold is to develop a unified vision for the specialty. The purpose of advancing PM&R Bold is to transform the specialty in alignment with that new vision that you've created. Your academy has adopted the vision statement as our own and will use it to guide our strategic plan and to lead the specialty forward. As your president, I have adopted my own theme for this year, Advancing PM&R Bold, a race to success. Throughout this past year, I have been using my home state of Kentucky and horse racing as an analogy for the work your academy has done to put our specialty in a position to win this healthcare race. I hope you've enjoyed my stories. If you haven't had a chance to read all of them, they're on our website. You might consider this address celebration, perspiration, inspiration, and participation. For I will spend the next 20 minutes celebrating our many accomplishments over the last year, highlighting the hard work and perspiration your volunteer colleagues have put into reinventing the academy and transforming it into a specialty organization that will lead healthcare by having it value function and the role of physiatry. I also hope to inspire you with the plans for the future and ask that you engage and participate in our new organizational structure and activities in an even more dynamic way. In other words, let me introduce you to the new Academy of PM&R. Let me pause for a moment to take account of who we are as a specialty and as a specialty organization. There are over 11,000 physiatrists and over 9,000 active Academy members. 28% of us have subspecialty certification. 13% are in private PM&R practice groups. 13% are in solo practices. And 18% are in multi-specialty private practice groups. 28% identify themselves as academicians. 20% are employed by hospitals. And 4% work for the VA or the military. I am proud to say that today we have over 1,900 physiatrists in training, of which a third are here today alongside you and represent over 2,800 annual assembly attendees this year. 3/4 of you read the Physiatry newsletter. Almost 4,400 participated in educational activities on the Academy portal. And over 500 of you posted comments on the Phys Forum, many of which I read. And over 600 members volunteered for committees this past year. Because we are a small but diverse specialty, I felt that it was a high priority that we strengthen our relationships with our sister organizations for the benefit of the specialty. I am happy to say we have much stronger and more transparent relationships, especially with the AAP. I thank Dr. John Shea, their president, and their executive director, Tiffany Knowlton, for that. We are currently collaborating on several important initiatives, including the role of graduate medical education and preparing our coming workforce for the envisioned future models of practice. Earlier this year, we announced a strategic alliance with the American Congress of Rehabilitation Medicine to increase healthcare's value of rehabilitation as medicine. And as you know, we have been engaged with the American Board of Physical Medicine and Rehabilitation around the importance of reducing burden and cost for continuing certification. and in providing a new structure that will be both simpler and more meaningful for us. We'll talk more about that later. As you know, the opioid crisis has made one of the greatest impacts on healthcare in decades, and its effect on physiatry has been significant. I want to thank Dr. Eric Shaw and the entire Opioid Crisis Committee for creating a well-written and very strong Academy position paper on this topic, published in the PM&R Journal earlier this year. You may also refer to the Academy website if you have not read it. Additionally, on the Me website, you can also find a complimentary educational resource, the RIMS Playbook for Opioid Prescribing. And finally, Dr. Bertha Madras will also address the important issue later in this week during Friday's plenary. I encourage you to attend. Anyone who has played a sport believes Muhammad Ali's words when he said, "The fight is won or lost away from the witnesses, behind the lines, in the gym, and out there on the road, long before I danced under those lights." So many of the Academy's advocacy efforts are performed behind the scenes over many hours with no one looking. I thank Dr. Scott Laker, Chair of the Quality Practice Policy and Research Strategic Coordinating Committee, and the Healthcare Policy and Legislative Committee for all of their hard work. Here are many of the examples of what has been accomplished this year. I look out today on an audience of geniuses. If you don't consider yourself a genius, at least you are brilliant in your hard work and discipline in getting you where you are today. Because of the technology-driven and team environment in which we work, physiatrists are natural innovators and influencers. We should use these skills convincing others of the importance of function and our impact on this outcome. Over the next year, as Advancing PM&R Bold Initiative sunsets, the Academy will be launching a new initiative and new programs designed for innovators and influencers in each of us. Please keep an eye out and join in. Tomorrow, Katie Sanchez of the Disney Innovation Team will be sharing some of those trade secrets with us. And I encourage you to attend and take home some of that Disney magic. Over this last year, under the leadership of Dr. Priya Chandan, the Academy has embraced physiatry's role in caring for individuals with intellectual and developmental disabilities. Dr. Chandan is currently developing a curriculum for medical students and residents, and the Academy has received a grant from Special Olympics International to advocate for an inclusive healthcare environment. Let me win. But if I cannot win, let me be brave in the attempt. Maybe this should not only be the motto of the Special Olympics, but the battle cry of our Academy and our specialty. 50 years ago, the Special Olympics was started by Eunice Kennedy Shriver. We need to do a better job as a specialty, not only caring for able athletes, but for those with physical and intellectual disabilities. We need not only to help athletes perform better, but advocate for a healthcare environment of inclusion. Muhammad Ali started from humble beginnings in Louisville, Kentucky. He won the gold medal at the 1960 Olympics. While his fame grew as world heavyweight champion, he joined the Muslim faith and became a conscientious objector against the war in Vietnam. In protest against war, Ali threw his gold medal off the bridge and into the Ohio River. He was stripped of his title and put in jail for his resistance. As you can see, his conviction paid off. He not only returned to regain his heavyweight title, but is shown here receiving the National Medal of Honor for his courage and message of peace. In 2012, I was involved in writing a paper that anticipated what physical medicine and rehabilitation would look like in the year 2032. Although there were many potential options, we felt that the greatest likelihood would be that big data would control healthcare. It certainly seems to be headed that way. Whoever owns the data is likely to win in this given scenario. it is important that you own your data and that the specialty is the repository for that data to protect your future. To that end, the Academy has made a courageous step in starting a qualified data registry for the specialty. This is neither a small nor inexpensive step. However, we feel it is necessary in order for each of you to improve the evidence base and quality of your care and to leverage your data to protect your livelihood and your place in healthcare, both locally and nationally. I strongly encourage each of you to sign up and take part in this registry. Make your voices heard. Make your data count. There are booths available here at the Assembly to answer your questions and to help you get started. Over the last year, your Academy has used a diversity and inclusion consultant to help our Board of Governors better understand our decision-making processes, intrinsic biases, and to develop best practices for creating a culture of inclusion moving forward. I applaud our entire board's efforts, but want to especially thank Dr. Deborah Vennessy, Dr. Michelle Gittler, Dr. Amy Houtrow, Dr. Charlotte Smith, Dr. Bob Rinaldi, and Dr. Stuart Weinstein for their insights and leadership through this process. I am proud to announce today the creation of a diversity and inclusion committee which will help to oversee this change in our organizational culture so that inclusion and engagement become who we are and what we do every day. I congratulate Dr. Carla Watson of Chicago as the chair of this new committee. The Academy has placed a request for volunteers to sit on this committee and encourage you to apply so that we can have this committee filled with passionate members by the beginning of 2019. Speaking of culture, in order to change the culture of physiatry, we must first understand the culture that exists. The Academy consulted an ethnologist to study our culture and found some very interesting truths. We are a small and somewhat under-recognized and misunderstood specialty. We do not own an organ system, but rather function is the tie that binds us. We have a nomadic culture. This doesn't mean that we are wandering in the desert lost, but rather that we grow where we are planted. Our flexibility and diversity are both our strength and our weakness. Historically, we have been passive receivers of patients, but in the evolving healthcare environment, we need to become more assertive in order to stake our ground. What is needed now is unity and a positive brand recognition. In order to obtain this, the Academy will need to provide you with the necessary training and resources, such as the data from your registry, to give you the negotiating leverage. Positive results will lead to positive affirmations and positive self-identification. Like Muhammad Ali said, once that belief becomes a deep conviction, things begin to happen. He believed he would shake up the world. He believed he would become the greatest of all time. And that little boy who was once beaten up and had his bicycle stolen became the most recognized sports figure of the late 20th century. Belief in oneself is vital to success. Ladies and gentlemen, don't be fooled. The truth is there are attacks on our specialty. The very definition of a rehabilitation physician is being challenged. The CMS regulations that you see here do not clearly define a rehabilitation physician or a rehabilitation medical director. Many facilities are trying to use a non-physiatrist in this role. Would you open a cancer center without an oncologist? Would you develop a heart program with a primary care physician who has an interest in cardiology? Of course not. Then why would you sit back and allow someone who's not trained in physical medicine and rehabilitation to take your job? It's time to be assertive. Yes, it's time to be bold. The Academy has come out with a very strong position statement that we intend to send to CMS with the goal of having them clarify and update their definitions. I encourage you to read these and submit your feedback to the Academy. You'll be receiving these electronically in the near future. Finally, for the last several years, the Academy has been working on your behalf to encourage the American Board of Physical Medicine and Rehabilitation to restructure maintenance of certification. Each of you were sent an email 3 weeks ago with our current position on MOC, encouraging the American Board to make changes now. If you have not seen it, here it is. The full version and a form letter that accompanies this are on the Academy website. Well over 400 of you have sent letters to the American Board asking for change. I want to say today, thank you to the American Board of PM&R's CEO, Dr. Kaelin, their board chair, Dr. Tony Chiodo, and their entire board for responding with swift changes toward a longitudinal, formative assessment tool that will simplify MOC and reduce cost and burden for practicing physiatrists. Thank you. As I conclude my address, I hope to inspire you all to engage in the new and improved American Academy of Physical Medicine and Rehabilitation. In adopting the vision of the future of our specialty that you created, the Academy has developed a new strategic plan and a new organizational structure to lead the specialty. In order to embrace and proactively create a culture of inclusion and engagement, the Academy will be creating a new strategic coordinating committee by the same name. Additionally, in order to promote and expand our specialty brand to external stakeholders, such as referring physicians, patients, payers, and legislators, the Academy will create a specialty brand expansion strategic coordinating committee. Our organizational structure will need to change, and you'll see the beginning of that at this annual assembly. Over the last several months, think tanks have been assembled utilizing experts in the areas of musculoskeletal and post-acute care medicine, placing a framework on the envisioned future models of practice. Each of you are now being asked to join the learning collaboratives during this meeting on Friday and Saturday, where you will add your expertise and your experience to finalize the plans for these very important aspects of our specialty. We are exploring the other future learning collaboratives and other important areas of PM&R, including cancer rehabilitation, pediatric rehab, and pain management as examples. Finally, moving forward, our diverse specialty requires a dynamic engagement model, as each member identifies with colleagues who share similar backgrounds, practices, and interests. We call these self-identified groups member communities. They may be based upon clinical interest, the location in which you practice, or other self-identified racial, ethnic, or demographic backgrounds. The goal is to inspire passion and meaning in your education and in your networking opportunities while at the annual assembly and beyond. Each member community will have the opportunity to create educational programming for future annual assemblies, as well as select a delegate who will represent them in communicating important information to and from the Academy leadership. Look for more on this in the days and weeks to come. Service to others is the rent you pay for your room in heaven. I think each of you are doing a great job paying your rent. Help the Academy build a fitting memorial to your service and to your specialty by investing your time and your talent to this organization so that together we can lead the advancement of physiatry's impact on healthcare. Physical medicine and rehabilitation is in a race to success in healthcare. We must define who we are and who we will be. How, you ask? Be bold. Be brave. Believe in the skills and unique knowledge that we have as physiatrists. Be the difference in your patients, your healthcare system, and your specialty. Engage with the Academy of PM&R and be part of leading the specialty forward to our envisioned futures. In closing, just as Alan Shepard looked back fondly on the legacy of the Apollo Moon program created by President Kennedy, I hope that one day we will be able to look back on these bold initiatives and say they strengthened our academy and engaged our members in a way that unified the specialty and led to us achieving the envisioned futures we worked so hard for. This is not my legacy, for I have truly stood on the shoulders of giants that have come before me and have simply set a course for those that will follow. I love this specialty. I love you, my colleagues. I love this organization. And I humbly thank you, our members, for allowing me to serve you as your president. God bless.